How seniors should drink water for blood sugar and diabetes. Are you doing this wrong? Most people over 50 think they understand water. You drink when you feel thirsty, you drink with meals, maybe you have a water bottle on the counter as a vague reminder to drink more than you currently do. Simple, right? Here is what I want you to consider before we go any further. Hydration is not simply a wellness suggestion floating somewhere in the background of your health. For someone managing blood sugar, whether you have a formal diabetes diagnosis or you are simply watching your numbers creep upward with age, how you hydrate is directly connected to a specific hormonal system inside your body that most physicians never take the time to explain in a routine appointment. I am Dr. John, and today I want to walk you through exactly how water intake affects your blood sugar, why the timing of your hydration matters considerably more than most people realize, what the actual research shows rather than what internet folklore claims, and the specific practical adjustments you can make starting today if you are over 50 and managing your blood sugar. Let me begin with the foundational mechanism, because understanding it changes how seriously you take this topic. The hormone connecting dehydration directly to elevated blood sugar. When your body becomes even mildly dehydrated, it activates a hormone called vasopressin, sometimes measured indirectly through a related marker called copeptin in research studies. Vasopressin's primary biological job is to help your body conserve water by signaling your kidneys to retain fluid rather than excrete it. Here is the part that surprises most people, including many physicians who have never specifically studied this connection. Research has identified vasopressin as an independent risk factor for type 2 diabetes, metabolic syndrome, cardiovascular disease, and earlier mortality, separate from the other risk factors we typically discuss. Studies in both animal models and human populations have found a genuine causal relationship between elevated vasopressin levels and elevated blood glucose concentrations. Researchers investigating this relationship directly have demonstrated something specific and measurable. When water conservation hormones like vasopressin were experimentally stimulated in study participants, those participants showed blood sugar levels 10 to 15% higher during a glucose tolerance test compared to when those hormones were not stimulated. That is not a trivial difference. That is a meaningful shift in how your body manages glucose, driven specifically by your hydration status rather than by what you ate. This gives us a genuinely actionable insight. Because vasopressin can be suppressed by increasing your water intake, researchers have hypothesized and begun testing directly whether deliberately increasing water consumption in people who typically drink very little could lower blood glucose and potentially help prevent the progression toward diabetes. A pilot study testing this exact hypothesis took adults with low habitual water intake and elevated copeptin levels, the marker reflecting vasopressin activity, and had them add 1.5 liters of water daily on top of what they were already drinking, sustained for 6 weeks. The researchers were specifically looking at whether this intervention could measurably reduce copeptin levels and, as a secondary measure, whether it could reduce fasting blood glucose. This research is part of a larger ongoing trial structure, including longer-term studies extending the same basic intervention, drinking an additional 1.5 liters of water daily across a full 12 months, specifically measuring the change in fasting blood glucose from before to after the intervention. I want to be honest with you about where the science currently stands, because overstating preliminary research does nobody any favors. This is an active and evolving area of investigation. The mechanistic relationship between dehydration, vasopressin, and glucose regulation is well established. The question of exactly how much benefit a senior with existing blood sugar concerns can expect from optimizing hydration specifically is still being refined through ongoing research. What we can say with confidence is that the relationship is real. It is biologically mechanistic rather than coincidental, And it gives you a genuinely actionable lever to work with starting today, even while the precise magnitude of benefit continues to be studied. Now let me explain the second major mechanism, because hydration affects blood sugar through more than just the vasopressin pathway alone. How dehydration directly concentrates the sugar already in your bloodstream. Here is a simple way to think about this that I find helps most people grasp it intuitively. Your blood is, among other things, a fluid carrying glucose throughout your body. When you are well hydrated, that glucose exists within a larger total volume of fluid, effectively diluting its concentration. When you become dehydrated, the fluid portion of your blood decreases, while the glucose circulating within it remains roughly the same in absolute terms. The mathematical consequence is that the same amount of sugar is now concentrated within a smaller volume of fluid, which means your measured blood glucose level rises, independent of anything you ate. This is precisely why a well-known nutrition researcher studying hydration specifically pointed out that one of the simplest practical signals for whether you are adequately hydrated is built directly into your own body. Pay attention to how frequently you are using the bathroom throughout the day. If several hours have passed without a bathroom trip, that is a meaningful sign you have not been drinking enough water. The color of your urine offers another simple, free, immediate indicator. Pale, light yellow generally reflects adequate hydration. Dark yellow suggests you need more fluid. For someone managing blood sugar specifically, this concentration effect matters beyond simply the number on your glucose meter. Your kidneys play a central role in regulating blood glucose levels, filtering and helping manage the sugar circulating through your bloodstream. Adequate hydration is essential for your kidneys to perform this regulatory function efficiently. When you are dehydrated, your kidneys are working with reduced fluid volume to perform the exact same filtration job, placing additional strain on organs that, in long-standing diabetes, are already vulnerable to damage from chronically elevated glucose. Maintaining good hydration is one of the more straightforward things you can do to support healthy kidney function, specifically in the context of blood sugar management. Now let me address the question embedded directly in this video's title. Are you actually doing this wrong? Let me walk through the most common hydration mistakes I see in adults over 50 managing blood sugar, because the mistakes themselves are often more instructive than a generic list of correct behaviors. Mistake 1. Waiting until you feel thirsty before drinking anything. As we age, our internal thirst signaling mechanism becomes measurably less reliable. By the time you consciously feel thirsty, you have typically already been operating in a mildly dehydrated state for some time. For someone specifically managing blood sugar, this delayed signal means your glucose readings may already be running artificially elevated purely from concentration effects before your body even alerts you that fluid intake is needed. Waiting for thirst as your cue is consistently too late, particularly after 50. The fix is straightforward. Drink on a schedule rather than waiting for a sensation. Specific, scheduled prompts. A glass upon waking, a glass with each meal, a glass mid-morning and mid-afternoon work considerably better for older adults than relying on thirst as the trigger. Mistake 2. Drinking the bulk of your fluids all at once rather than distributing intake evenly throughout the day. Some people drink very little through the morning and then try to compensate with large volumes in the evening. This pattern is problematic for several reasons specific to blood sugar management. Your insulin sensitivity, meaning how effectively your body responds to insulin's signal to manage glucose, naturally fluctuates throughout the day and tends to be lower in the evening hours. Concentrating large fluid volumes late in the day does not align well with this natural rhythm, and for many people it also disrupts nighttime sleep through increased bathroom trips, which independently worsens blood sugar regulation through the sleep disruption itself. The fix is steady, distributed intake. Smaller amounts consumed consistently across morning, midday, and afternoon, tapering somewhat in the evening, supports both stable glucose management and better sleep. Mistake 3. Drinking water specifically before meals, but not understanding why this timing matters, or skipping it because it seems unimportant. Research has specifically identified pre-meal water consumption as a meaningful, actionable timing strategy for blood sugar management. Drinking water before a meal supports healthy satiety signaling, meaning your sense of fullness, which can reduce the tendency to overeat and the resulting larger glucose load your body has to manage afterward. Beyond the appetite effect, maintaining good hydration status going into a meal supports your body's overall capacity to manage the incoming glucose load efficiently through the kidney function and vasopressin mechanisms already described. A practical habit worth adopting: a full glass of water roughly 15 to 20 minutes before each meal, consistently, as part of your routine rather than an occasional afterthought. Mistake 4. Assuming that any clear beverage counts the same as water for hydration purposes. This mistake matters enormously and is genuinely worth addressing directly. Many people, when thinking about their fluid intake, mentally lump together water, coffee, tea, flavored sparkling beverages, and electrolyte drinks as roughly interchangeable. They are not, particularly for blood sugar management specifically. Electrolyte drinks and many sports beverages frequently contain hidden sugars that directly affect glucose levels, sometimes substantially. Always read labels carefully and account for the carbohydrate content of any beverage as part of your overall blood sugar management plan, not simply as a hydration source you assume is neutral. Coffee deserves a specific clarification because outdated advice about caffeine and dehydration continues to circulate widely. Current research indicates that moderate coffee consumption, generally cited around 3 to 4 cups daily, actually contributes positively to overall hydration rather than causing the dehydration older guidance assumed. Individual responses do vary, so this is not a universal license to rely on coffee as your primary fluid source, but it does mean you do not need to treat your morning coffee as somehow working against your hydration goals. Alcohol is a different matter entirely and deserves direct mention. In genuine moderation, alcohol may have a relatively minimal direct effect on glucose levels for some people. However, alcohol meaningfully disrupts sleep quality, and sleep quality is closely and bidirectionally tied to metabolic health and blood sugar regulation. Excessive or sustained alcohol consumption over time is directly linked to insulin resistance, the progression toward type 2 diabetes, and liver damage, the liver being a central organ in glucose regulation. If you are actively managing blood sugar, alcohol deserves genuine caution rather than being treated as a neutral beverage choice. Mistake 5. Not accounting for how medications commonly prescribed to seniors directly affect hydration status. This is a mistake almost nobody discusses, and I want to spend real time on it because it is specifically relevant to the audience watching this video. Research examining hydration status in older adults has found a clear and statistically significant relationship between certain medication categories and reduced water intake. Specifically, cardiovascular medications were found to be significantly associated with lower water intake in men in this research. This matters because so many adults over 50 are taking exactly this category of medication for blood pressure or heart-related conditions, frequently alongside diabetes medications since cardiovascular disease and diabetes so commonly occur together. Diuretic medications, sometimes called water pills, deserve particular attention here because their entire mechanism of action involves increasing fluid loss through urination. If you are taking a diuretic, your baseline fluid needs are genuinely higher than someone not taking that medication, and your risk of inadvertent dehydration with its accompanying effect on blood glucose concentration is correspondingly elevated. This is not a reason to stop a prescribed diuretic on your own. It is a reason to discuss your specific fluid intake target directly with your physician, since your medication regimen changes what adequate hydration actually looks like for you personally. If you are taking multiple medications, a situation extremely common among adults over 50 managing both cardiovascular and metabolic conditions simultaneously, it is genuinely worth having a direct conversation with your doctor or pharmacist specifically about how your medication list affects your hydration needs, rather than assuming a generic hydration recommendation applies equally to you. Now, let me give you the practical day-by-day framework for getting this right. What an actual day of correct hydration looks like for blood sugar management after 50. Immediately upon waking, before coffee, drink 1 full glass of water. Overnight is the longest stretch most people go without fluid intake, and this glass addresses the mild dehydration that is accumulated by morning, supporting more accurate readings if you check your blood sugar shortly after waking. Through the morning, continue with regular modest amounts rather than large infrequent gulps. A glass roughly every hour or two during your waking hours is a reasonable target for most adults, adjusted for your individual size, activity level, and any specific guidance from your physician. 15 to 20 minutes before each meal, have a full glass of water specifically. This supports both the satiety benefit and the kidney and metabolic readiness benefit described earlier. If you drink coffee, enjoy it as part of your normal routine without worrying that it is working against your hydration. Moderate intake genuinely counts toward your fluid total, according to current research. In the afternoon and evening, continue steady intake, but begin tapering somewhat as bedtime approaches, particularly if nighttime bathroom trips have been disrupting your sleep. The goal here is balancing adequate total daily hydration against the practical reality of uninterrupted sleep, which itself matters enormously for blood sugar regulation. If you take a diuretic or any cardiovascular medication, build in slightly higher total fluid intake than you might otherwise assume necessary, and confirm your specific target with your physician rather than guessing. Track your own simple indicators regularly. The frequency of bathroom trips and the color of your urine remain 2 of the simplest, most immediate, cost-free signals of your hydration status, available to you without any device or app. If you use a continuous glucose monitor, pay attention to how your hydration patterns correlate with your glucose trends over time. Modern monitoring technology allows you to directly observe how dehydration episodes correspond with glucose fluctuations in your own specific case, which is considerably more useful than any generic guideline because it shows you your own body's actual response pattern. A few important clarifications before I close, because precision matters here more than enthusiasm. Drinking water does not directly and immediately lower an elevated blood sugar reading the way a medication might. What sustained, well-timed hydration does is support the underlying physiological systems, the vasopressin pathway, kidney function, blood concentration effects, and appetite regulation that collectively influence how well your body manages glucose over time. This is a supportive, foundational habit operating alongside your prescribed treatment plan, not a substitute for it. There is no single universal water intake number that applies correctly to every person. Your appropriate target depends on your body size, your activity level, your climate, your specific medications, and any kidney or heart conditions you may have. If you have been told by your physician to specifically limit fluid intake due to kidney disease, heart failure, or another condition where fluid restriction is medically necessary, that guidance takes precedence over everything discussed in this video. Please follow your physician's specific instructions rather than generic hydration advice if there is ever a conflict between the two. If you notice your blood sugar consistently elevated despite improving your hydration habits, or if you experience symptoms of either dehydration, such as dizziness, dark urine, or confusion, or symptoms of significantly elevated blood sugar, such as excessive thirst, frequent urination, or unusual fatigue, contact your physician rather than attempting to manage the situation through hydration adjustments alone. Let me bring this together with the core idea I want you to walk away with today. Hydration is not a peripheral wellness suggestion floating somewhere outside your actual blood sugar management plan. It connects, through specific and measurable hormonal and physiological pathways, directly to how your body regulates glucose, particularly as you age and particularly if you are managing diabetes or its early warning signs. The mistakes most people make, waiting for thirst, drinking unevenly throughout the day, ignoring pre-meal timing, treating all beverages as equivalent, and overlooking how their own medications affect their fluid needs, are all genuinely correctable, starting with your very next glass of water. This is Dr. John. Drink with intention, not just when you remember to. I will see you in the next one.